We visit Chris Kiania's home in Mwingi, Kitui County and find him attending to his kettle after a hard day's work. The 35-year-old lawyer is joined by his wife Rachel Nzuna. It is a joy to watch their 2-year-old daughter Immaculate Mutanu as she plays. She is a blessing they received after a 9-year wait in a long and trying period without a child of their own.
We had a very high expectation that very soon we shall be able to get kids, but that was not the plan of God. So we waited and waited, nothing was coming up.
Challenging experience in terms of every day anxiously waiting for something to happen, asking ourselves what's wrong with us.
For them, they had to seek medical assistance, and after numerous tests, they were given a clean bill of health and told to wait.
In 2006, the doctor decided that since we have really waited for long, we do a laparoscopy to open up the tubes so that you can check whether there are any blockage there. Then they did it in 2006. But after that, we had very high expectation that immediately we'll get a kid, but it did not happen that soon.
The couple turned to divine intervention in their quest to get a child and built this chapel within their house as a sign of dedication. Infertility is the inability of a woman to carry a pregnancy to full term, while in males, it is the inability of a man to achieve a pregnancy in a fertile woman. We sought some answers on infertility from Dr. John Ongech, an obstetric gynecologist at Kenyatta National Hospital, on the leading cause of infertility.
Blockage usually can result from maybe some sexually transmitted infection that somebody could have gotten earlier, but they were not able to know that they had them. Other cases also, you find probably somebody had procured abortion earlier, which was not done well, and so an infection is introduced into the tube, and that can also cause blockage of the tube. Lack of sperm or abnormal structure of the sperms, so it's all related to the sperms. And some of these men, you could find that either they're like men who are long-distance truck drivers, men who take a lot of alcohol, smoke a lot, chew mirror. This group of men will probably have sometimes abnormal sperms, or had somebody hit your testes when you're doing sports earlier, or had some infections of the testes.
How can a couple increase their chances of getting a baby?
Drinking, smoking, and all that kind of thing affects, say, spermatogenesis. So if people eat, especially fruits with a lot of vitamins, it enhances us to have good spermatogenesis and quality sperms. When men are stressed, they get erectile dysfunctions. They cannot erect. These hormones and chemicals produced during stress can interfere with the fertilization. And we advise couples is to relax.
The treatment for infertility vary according to the degree of infertility.
Basically, the corrections can be first counseling, then surgical, then we have the medical intervention. Of course, that's for the woman. Then the man, as I told you, most of the issues are to do with the sperms. Yes. So depending on what we find, if the sperm is low, there's some drugs we can give to stimulate the spermatogenesis process.
For Rachel, she was given fertility pills called Clamid, which did the trick for her. The couple know only too well that children are a prized asset and lack of them comes with stigma.
Culturally, one will be told, maybe you've been bewitched, maybe this is what has happened, maybe you have been, cursed. But
African society, that whenever there's infertility, it's usually the woman which is the problem. So you can see that the reality on the ground is that men are equally responsible for infertility.
They encourage other couples that there are immense options.
But the couple is incapable of getting a child. The law allows for adoption, even though the process is tedious, expensive.
Stella Kaleche for Health Matters.